As we all know, our country is going with major crisis about healthcare. It's about opioid crisis. Every day, number of people are dying because of opioid overdose. How this happened? Over the period of time, doctors started prescribing more and more opioids to the patient who need help for their severe pain. At that time, doctor did not knew that opioid is addictive. As a result, when they stopped prescribing this medication to the patient, patients started looking into open market, and that's where they started mixing standard prescription with heroin and synthetic opioid, and they started dying. So what is our government is doing? Our government is spending significant amount of money to help recover the patient. At Oracle, we partner with state and local government to create a solution which quickly can be implemented to help patient to find the right treatment, right facility based on their need. This particular solution is multi-channel enabled, so patient can use either website, or they can use mobile phone, or they can get simple help through the chatbot. So here is a website we have built which help the patient to get right treatment. This particular website is enabled multi-channels, which means either you can have web front end or you can have mobile front end of this particular website. Also, if person like to use the chatbot, you can have same user experience across all these channels. Now let me walk you through various menu here. The Learn More menu will provide you the frequently asked questions and knowledge base for getting recovery in a various treatment if I want to research furthermore here. I can search here and get various articles and details about the knowledge base. But the core part is if I want to search a facility, I'll click on Get Help. This will start asking me various questions based on my profile. Either I can do for myself or for my family member. And based on my selection, it changed my questionnaire. So if I'm doing for my spouse, my question is changed differently. So let's assume here I need a treatment for myself. And then it will ask me, which city do you live in? Example, I'm living in Albany, New York. And the next question is, how many miles are you willing to travel for your treatment? And in this scenario, let me choose maximum 10 miles from my home I want to travel. Which substance do you use? Let's pick a codeine. I can add another substance. Sometimes I'm using multiple substances and say benzomorphine. When was the last time you used substance? Within last 7 days. What is your health insurance coverage? And in this scenario, I may have health insurance, I may not have. But let me pick Aetna here. So these are the mandatory questions which patient need to answer. Some of the question is optional. People may choose to reply or may not. How many times you tried to get treatment in your lifetime? Let's say 3. Again, till this point, there is no PII information or personally identified information. Everything is anonymous. Based on this information, when I search it, it asks me confirm my information, and it will show me all the facility in my 10 miles of a radius from my home. And I can zoom out, zoom in, I can click the facility here. It will provide me the address, phone numbers, how good the facility is based on the people's feedback. And finally, the wait list. Is there any wait list to get treatment or not? It will provide me these details. The same information you see on the right-hand side. At this moment of time, I can take this information, I can pick up a phone, and I can call directly to the provider and get treatment if I want to be anonymous. So once I decide to enroll through application, this is time it's going to ask me more detailed information about my name. I can put my phone number and my email address, and I can submit it. Once I submit, it will send this information to provider, and then provider will call me or email me for my further appointment. So as you've seen, this is how easy to use this particular website to get right treatment at right facility for the patient. Now, if you're a provider, and if you move your facility, or if you change your phone number, or if you change your any information, example of wait list, you can also change through single click here. You need to log in with your login ID, and Once you log in, you choose your profile, select your organizations, and simply change my waitlist number from 5 to say 3, and then I update it. Within the same portal, both patient can work as well as provider can update information. So now let me walk you through the architecture of this particular solution. We have 3 personas: the patient personas, provider, and the live agent. Behind the scene, we are using Oracle Service Cloud software service module, and then it provides you deep security through identity management cloud service. Now, when a patient try to get help, we ask a lot of questions. That question is being written in Oracle policy automation. And then if you need further assistance, we can connect with the live agent and somebody can pick up the phone. And then also on top of that, we can put analytics so that if we need to figure out from a key performance indicator perspective, what is the demography, which area has a more problem, which doctors, which facilities getting more treatment, we can generate analytics on top of it. So as you've seen in demo, how simple to use for patient as well as the provider. Apart from simple to use, is easy to implement, lower in cost, and apart from that, we also partner with right system integrator and the business domain expert who can help you to configure your need. This is how Team Oracle can work with state agency to help the opioid patient to recover faster.